so much info, and we're getting so much information about them. Can you think of another drug over the last 10, 15 years that you know this much about, other than these weight loss drugs? I mean, maybe you get the occasional ad on your Hulu, your Netflix, but I don't think we've been inundated with as much detail as we have these GLP-1 agonists. So I think this book is really does a great job of going through not just this class of drugs, and talking about these medicines, but really talking about putting it in the context of weight loss and culture, and even getting into the psychology of weight loss, and what these drugs what these drugs do and don't do. But before we get into it, I just want to go ahead and thank Indiana Humanities, one of our sponsors, Indiana Humanities, Indiana Sciences. I want to thank our public libraries who helped make this happen. And y'all, I gave my shout out for Spotify. If you have a Spotify premium account, you're losing out on free audiobooks if you're not using it, and this book was one of them. So check for all of our future books. Check your Spotify. See if you have a free audiobook. See if it's available for free. I'm saving y'all money. In this economy, every $7-10 is worth it, let me tell you. And so with that, I want to get into our discussion. And you might be saying to yourself, you're saying, Allison, you're there by yourself. Y'all are in for a whirlwind, because I don't know if I've really talked about my academic background and my scientific background. I do have a PhD in cell biology, anatomy and cell biology, from the Indiana University School of Medicine. And this book actually talks about a lot of my experience and my academic background. So my PhD work, I maybe have talked about the bones. I love the bones. But I also did a lot of muscle biology research. And specifically, I worked in cachexia, which is a wasting disease. And so a lot of the muscle biology work I did, it wasn't you can't just look at skeletal muscle as an isolated tissue. You also have to look at it in the context of your body composition, because that your adipose tissue or your fat tissue, specifically talking about our visceral fat, because there are lots of different types of fat, which we're going to get into. They are an active tissue. They are a living tissue in your body. They are not just a static, maybe you've seen like the people at the gym, they have, here's what 2 pounds of fat looks like. It is not this static object. Fat is a living tissue, a living cell in your body, and it contributes to so much what we call crosstalk. And really, it's how your tissues communicate, and how your skeletal muscle and your fat and your bone all talk to each other, and they all contribute to your metabolism, for example. And that all plays into your body composition. And my expertise was in aging, Alzheimer's disease, and cancer, and typically the loss of fat, which is what we talk about in this book, but in a different context. And so that is a little bit of my academic background, but I also professionally, and this is my disclosure to you all, I'm currently an employee of Eli Lilly and Company. I do not work on these weight loss compounds, but as an employee, I am very knowledgeable about these. This is something that as an employee, I know about, I read about. It's obviously important. In the news, anytime, I don't know if anyone else's mom does this, but if she thinks that it's something that you'll be interested in, she sends you a link to an article, and she'll say, "Ooh, look, I saw this and they mentioned your company." I'll go, "Mom, I don't work in that. I don't know what that is. I'm not a salesperson. I don't know anything about sales." And she's like, "Well, they mentioned your company, so I thought you'd want to know." And so I get a lot of those from loved ones who obviously care, but I also, because I'm an employee, I get asked a lot of questions about these drugs because they are so popular, not just to use, but just out of curiosity. People want to know about these drugs, and especially, are they safe? What do they do? What are the side effects? Should I be worried? My friend started this. What should she expect? Oh yeah, my friend is on that drug, or my mom is on that drug. My uncle's on that drug. What can you tell me about it? And so I obviously, in this capacity, am not speaking on behalf of the company. I'm here as an individual. So let's start there. I am not speaking on behalf of Eli Lilly and Company, but I am an employee. And so I want you to take what I'm saying here tonight and our discussion with that in mind, because I think that's really important. But I think if you read through this book, you you are coming into this with a pretty well-rounded understanding of the complexities of this drug and the complexities of weight loss. And we can talk more about how pharmaceutical companies and how they play into kind of this weight loss. I don't want to call it a revolution, but it's revolutionizing, I think, how we're thinking and talking about weight loss, which is kind of ironic because these never started as a weight loss drug. They were initially approved for type 2 diabetes and the management of diabetes and blood sugar, and they also have this effect on weight loss, and it's due to their mechanism. So that is, I don't know if I've ever introduced my background like that in this forum, but it really worked out for this book very well. And I just wanted to give you all that primer and I also want to prime this by saying this is going to be a much more interactive session, not just because I'm here by myself, but because I think in particular the subject matter of this book, and we see it throughout the book, right? How many people does Johan interview, right? How many people does he interview? Not only experts, but people who are on these drugs or people who have tried to go on these drugs to deal with whether it's quality of life or whether it's disease management or whether it's just improved body image, which you could argue is a measure of quality of life. There are so many people who are struggling with weight, they struggle with body image, and they struggle with a culture that stigmatizes. And he talks about in the book how it's not just a cultural and it's not just a social stigma. It's like a very measurable stigma and bias that overweight and obese people face. And so this is something that, especially if you're a woman, you have experience with maybe not the drugs, but every other aspect of this book, be the food and the weight loss, maybe some of the trauma, the family trauma. Hopefully nobody drowned a kitten. That was kind of awful to read about in the book. But I think this is just something that's so unique right now for us, like in the present. And it is just so pervasive that I really want to just talk about this as a group, because I think it's something that unlike I think not some of the books that we read in this club, this is something that we all have very direct and very immediate experience and knowledge in. And I think that's really important to share in the context of this book, because I really think this book encourages us to talk about our experiences with weight loss, our experiences with food, and managing our relationship with food and weight and body image, and how these drugs fit into that broader picture. So with that, I want to start by what I don't think the author does well, which is defining what obesity is and isn't. So obesity is not a number on the scale, right? If you watched the Olympics, you saw athletes of all sizes competing and winning medals, right? Ilona Maher, I think, from the U.S. rugby team, has been a great and vocal advocate for, look, if you, for example, on the BMI scale, if you look at my weight and you look at my BMI, I'm obese, but I'm an Olympic athlete. So obesity isn't a number, but scientifically, really, it's just excess visceral adipose tissue. And when I say visceral adipose tissue, I say that typically it's referring to adipose tissue that collects in your like in your thoracic area, so mostly like in your stomach. We're not really talking about not just your stomach, but visceral adipose tissue is not, for example, the fat that lines your neurons, right? That helps. That is fat. Fat exists in your body in good ways. We think of visceral fat as bad fat, but you have fat in other areas of your body that serves an important function, right? So we have the fat that helps line your neurons. You have the fat under your skin, right? You have fat in your bone marrow that is actually really important. Like I said earlier, your fat is actually a living tissue and it's a living organism, and your fat communicates with your muscles and your bones, and it communicates even with your immune system, not in bad ways. We learn about in the book how excess fat can lead to inflammation. That's because your fat is living and is actively communicating with your body, and so this excess visceral tissue can lead to inflammation and specifically increases in inflammatory signals that can have deleterious health effects, which we learn about in the book. So I want to start with obesity is not a number. BMI is historically been, well, historically, we know BMI is not a great measure for health, right? There's no, you can have a BMI of 30 and be healthy. For example, we see like bodybuilders and people who have like excess muscle tissue, and they say, well, technically I would be obese on the BMI scale, but I'm not, I'm healthy. Not to say all bodybuilders are healthy. There are unhealthy ways of getting muscle, and I think maybe we are aware of some of them, like excess steroid use and things. But BMI is rooted deeply in racism and eugenics, and we know that BMI is deeply flawed. Comma but, I think the author Johan does a great way of saying, of pointing out that it can be used as a tool to point us in the right direction. It can be used to say, okay, well maybe your BMI is this. Let's do, for example, they talk about body composition, and let's do a body composition assessment. There are different ways to do this. If you want it to be like super accurate, you can get in a tub and do a displacement test. Most people don't want to do that in a lab in front of a bunch of people, because you have to get totally naked and get in this tub, and it's kind of weird. And also, they're not like at your Kroger, right? Not super accessible. So there are also what are called DEXA scans, which is you just lay on what kind of looks like a mattress and you get Xeroxed effectively. At least I felt like when I got it done, I felt like that was getting a Xerox. And they'll give you a measure of your body composition. Body composition is a much better way of assessing, I don't want to say health because it's not a health measure, but by assessing if you have excess visceral adiposity, if you have excess fat tissue, because it actually, DEXA will give you a measurement of your lean muscle mass. Lean mass is actually much better indicator of health, and much better indicator body composition wise of if you need to be nervous for certain health outcomes. And that is determined by age too a little bit. As you get older, you lose muscle mass, and we know that loss of muscle mass with age can have seriously predispose you for things like falls and fractures, which are really bad. But in the case of this book, I think it's really important to point out, and the author talks about this too, is that it's your body composition, and he mentions the word sarcopenia and sarcopenic obesity. Sarcopenia is just having low muscle mass. And so notice we're focusing on the muscle here because the muscle is actually so, we talk about fat being a living tissue. Your muscle is also a living tissue. Your muscle is the largest user of glucose. Your brain comes second. Okay, your brain's important. I'll give the neurologist that. Your brain is important. But your skeletal muscle is actually the largest, we call it a glucose sink, because your muscles, when you're contracting, your muscles are sending signals like little mouths to suck up all the glucose in your blood, right? Because that's how your muscles are getting energy so that you can move and you can run. And it plays into your metabolism and your whole body metabolism, right? And so that's how we get into these GLP-1 agonists, right? And we get into your gut hormones and insulin and sugar. I think when you think of your pancreas, you're probably thinking of insulin, you're thinking of diabetes. But there are actually a lot of hormones produced in your pancreas, and there's actually a lot of different cells in your pancreas that are involved in appetite and gut and weight, and satiety, as the author frequently goes back to. There's a lot of hormones going on, and glucagon and insulin, GLP-1 are just some. I think he mentions like ghrelin and leptin a little bit. There's a lot. It actually, those are even further regulated by your circadian rhythm and some proteins called clock and BMAL, BMAL1. So your circadian rhythm even plays into this, and your hunger cycles, which if you're like me and you have a really messed up circadian rhythm, that can also impact things like your weight, because I'm no longer eating on a regular cycle. You're messing up your gut's normal, and when I say gut, I broadly refer to your digestive system's normal cycles of hungry and full, right? So by things like stress, things like not taking care of your sleep cycles, not sleeping enough or sleeping regularly. Those can all have an impact on your gut hormones, which then has an impact on how much food you're eating, which then has an impact on how much sugar your muscles are able to take up, which then has an impact on how your fat is storing all that extra sugar, and now has an impact on your weight, and now you feel like you need to start a weight loss drug. So the biologically and cellularly, these systems are so complicated, and I think he does a really good job of kind of balancing that this is a medical miracle, and this is amazing that we have this drug that is effective in diabetes, it's effective in weight loss, and something he talks about, which we can get into later, but drug diseases that are heavily linked and tied to obesity. It seems like they're even having an impact there, and so the breadth of response that we're seeing is amazing. But there's obviously the concept of weight and body image is just so complex socially and culturally, and and even biologically, that it's something that I think we need to consider and take into account when we're talking about these drugs. So I want to take us into our first turn and talk, and I want to ask you, before reading this book and even after reading this book, what conceptions about weight loss did you have either challenged or reaffirmed? Are there things you hadn't considered about weight loss and maybe the struggles of weight loss, or maybe some of the different topics discussed in this book that you hadn't considered? Or did it strengthen what you already knew? You said, I already knew all that about weight loss and the complexities of it and the biology of it, because we get into everything in this book. So do you feel like your conceptions of weight loss and excessive weight gain were challenged in this book or were strengthened in this book? And I want to hear which ones and why. So I'll give you guys a couple minutes to turn and talk at your tables about that question, and then we'll come back and I want to have a broader group discussion. Thank you.
Yeah.
What's up, live stream?
Hello.
Okay. We got Rufus. Rufus.
Hi.
You never introduced yourself. So Rufus, for those of you on the live stream, you don't get to see him, but Rufus is always behind you, like you being the camera. Rufus, say hi. Introduce yourself.
Hi, everybody. I'm Rufus Cochran. I'm the executive director of Indiana Sciences, and 8 years, I think, and this is the first time I've been on this side of the camera.
8 years.
It's a pleasure to help facilitate a turn and talk, because it's kind of weird to turn and talk to yourself, right? Like, you don't want to just be the one person talking to yourself. So
I do it all the time. I really hate to be that person. I do it all the time.
So this has been really interesting. For the live stream, can we repeat like what the question was that we went into? Live stream with?
Yeah. So for the my live stream lovelies, I asked, what conceptions about weight loss did you have going into this book? Like, reading this book, what were your thoughts and conceptions about weight loss that were either challenged or were they strengthened? What were they and why? And I say that because there were we talk about food, we talk about psychology, we talk about body image, and we talk about trauma, and we talk about, there's so much in this book, and it's one drug. It is one concept, the concept of weight loss, but there's, as we see through the book, depending on kind of what I don't want to say what got you there, but depending on what got you to considering this class of drugs per se, kind of depends on your response to those drugs, how satisfied you are with the result of those drugs. And then afterwards, okay, I've lost the weight. I'm not happy because I didn't get what I wanted, or I didn't actually deal with what really the underlying problem was, and I hadn't considered it because I was so worried about, the number on the scale, but didn't actually really get at what was really harming me. And there, there was such a breadth of topic.
Yeah. Well, and I even think about some of like our previous discussions that we've had with other experts. Like, I think back to Bill Sullivan and his book, like Pleased to Meet Me.
Ooh, yeah.
Where one of the ones he brings up is, if your grandparents and your parents lived through periods of famine or like extreme hunger, that like those overeating whatever is expressed through those epigenetic interactions actually impacts your children. It's not just a single generational thing. So a lot of the times in society, we see obesity as this thing of self-control, but in reality, there are genetic factors that are acting on you before you're, when you're born, right?
Yeah.
And epigenetics, folks who've seen a lot of the live streams might be familiar with it, but it's that topic, right, of you have genes expressed through your environment that are passed on and have interactions on your body and your systems, right?
Yeah.
So, like, that's something I was thinking about as we were going through this. And the other one that you mentioned just a second ago was folks that this drug doesn't work for, right? Because that's a non-trivial amount of people that this drug doesn't work for, because it's not, you mentioned really well at the beginning, this isn't a drug that was designed to cause weight loss in all people.
No.
It's one of those serendipitous, I don't know, one of these things that we find an off-label use of a drug.
Yeah.
And we go, well, we can sell it to them too. Done.
Hell yeah, brother.
And maybe it'd be useful. You work in this space. Could you explain what like off-label use of a drug is?
Yeah, that's great. So when we talk about a drug label, that the label is what the FDA, and I'm speaking exclusively to my United States people, because I have to imagine that is an almost 100% of everybody. It's a similar process in other countries, let's be clear, but let's focus on the US. The label is what the FDA has said, this drug can be used for this disease in this context. So, for example, the label for a cancer drug, just to keep it really simple. The FDA will look at the data, the company will send the data in an application to the FDA, and they'll say, hey, look at this. We tested this drug in what we call clinical trials, where we're putting it in people with supervision. Obviously, a clinical trial is done. There's lots of oversight. They're done across the world, across medical centers, and clinicians will experimentally give this drug, which experimentally it's been assessed and esteemed safe and other. We can talk about that process, but it's assessed in a clinical trial, and in the case of these weight loss drugs, across thousands and sometimes even tens of thousands, when you put it all together, tens of thousands of people across a period of time, might be a couple weeks, might be a couple years, and then they take all that data, they analyze it, and they send it to the FDA, and they say, look, we tested, we gave people with type 2 diabetes this drug, and it lowered their A1C by X%. We deem that to be clinically meaningful, but you decide. Yeah. Here's all of the data. You tell it, do you think it's safe? Do you agree that it's safe? Do you agree that it works? And do you agree that people with this disease should take this drug for this reason? And the FDA could say, no, I don't think your data is very convincing. Yeah. They could say, well, actually, what if you tested it this way in this patient population? Or I want to see it stratified by men and women to make sure that it works in men and women, because we know historically clinical trials have only included men or predominantly men. Yeah. And sometimes that's fine. Sometimes it's not fine. And so they could ask for more follow-up information. They could ask for a different trial. And then they say, after, a lot of back and forth with the company and the FDA will finally, at the end, if they think that it is efficacious, they think that it works, they go, okay, ta-da, you are approved. Here is your label. Sometimes they'll talk about the label, and what it is approved for. All labels are actually publicly available. You can search them on fda.gov for any drug that you're interested in.
You're just browsing and checking it out.
But you can look those up. And so when we say off-label, so these are a great example. I think it's Ozempic is approved by the FDA. Its label use is for people with type 2 diabetes. Off-label, people use it for weight loss. And so the FDA didn't approve it for weight loss. They didn't look at that data. They didn't say, they may have seen it at this point. I mean, probably. But they have not necessarily gotten together in a large group, reviewed the data, almost like a form of peer review, and then talked about it. and then gone back. That whole process didn't happen,
Mm.
or it has happened and they said no.
Mm.
And so just because the drug is causing weight loss does not mean the FDA has approved it for that. And so if people, specifically clinicians, can use drugs in an off-label manner in a way that is safe. We see this a lot in like oncology trials and in cancer trials. It might not be approved yet, or it might be such a small, rare disease state that they need to apply a drug that's used in a similar context and use it in an off-label way. But in this case, for the weight loss drugs, it's typically a drug that is approved for type 2 diabetes, patients with type 2 diabetes, and then is being used for people who want the effect of weight loss who do not have type 2 diabetes.
So I guess my follow-up question is, we know it's safe because it's been tested through lots of groups of people.
Yeah.
We just don't know the efficacy of the drug for the specific use case at the level that the FDA would normally approve it for an on-label use. Is that?
Yeah. Well, and I think I should know this. I'm pretty sure Zepbound, which is tirzepatide, is approved for weight loss in those who do not have diabetes. I think. If I am wrong, Colonel Lilly will turn in his grave. No, I don't. They are, if they are not approved yet, they're under review for sure.
Yeah.
But they are definitely going for those approved. There's no way they're not.
Yeah.
But it doesn't necessarily mean that they're not safe for that use or that they're not being considered. It just hasn't happened yet. And because I will say this, part of the consideration, you have to think how many people, the population with type 2 diabetes is smaller than the population of people who are overweight or obese.
Yeah.
And so with a larger group of people, and they kind of indirectly touch on this in the book, larger group of people, you have a lot more possibilities, and people could react a lot differently. You're dealing with a much broader, more diverse population. Yeah. So your testing needs to reflect that. It needs to be a larger study across larger areas with way more people. And you've got to be laser eye looking, for side effects, because that's what people care about. And I think part of the concern with off-label use is people are experiencing side effects and they're saying, I didn't know this would happen to me. Or in the trials for type 2 diabetes, where we have a lot of published data, it's approved, this has been discussed, and it's something you discuss with your doctor. This side effect occurred, not frequently in patients with type 2 diabetes. Yeah. I don't have type 2 diabetes. I took this drug, but I am experiencing this. Yeah. And it wasn't a common side effect there, but it is here. Yeah, and I don't understand why. Well, you don't have the same biology, especially when we're talking about gut hormones and insulin sensitivity. You don't have the same biology as somebody with type 2 diabetes. That's why it's important we test that super rigorously. And that's where the danger of off-label, not danger, but the caution with off-label use comes with something like this.
Well, all of that's really interesting because it helps just like reinforce this idea of like when we take drugs in the US, like what it takes for a drug to get to the point where it can be prescribed to you. And that level of scrutiny isn't the same all across the world. And even as I understand it, you have a better key on this. Like the US is even more stringent than Europe. And so we are one of the toughest markets to get approval in. So a lot of the times, like these will be approved in other markets, they'll go to market, and then it's not a year or two later until like we get approved here because of the extra levels of scrutiny that the US requires, which I don't know, makes me feel a little better when I take medicines here.
Yeah, when they're approved.
Because that's something that helps you realize the level and the role that the FDA plays to make sure what you're taking is safe, right? Yeah. Which is not the case for all things that you can take that say that they're going to get rid of your weight loss, right?
Girl, supplements. Let's talk about
So I don't know if we want to breach that topic yet, but I might
we're
in a little
there.
Easter egg our little breadcrumbs toward where we may be going.
Yeah, I want to dig more into like the concept of what is and isn't safe, and really get into the supplements and even the compounding, like the compounded semaglutide, and the compounded drugs that are available through an app that you don't have to see a doctor. Hey, what is that? You don't know. I don't know. Well, only God knows.
Well, and the thing that's, that can be a little insidious about these other treatments that aren't FDA approved is that, this issue of obesity is a real issue for so many people. And it's, as we kind of touched on, it's not an issue of willpower. In a lot of cases, it's genetic, it's hereditary, it's environmental.
Yeah.
And it puts a huge strain on your body to be obese, right? You're carrying around this extra weight it's having impacts on the different systems in your body, on your muscles, on your skeletal structure, right? And people want to feel good. People aren't out there going like, man, I just want to suck today.
I love my knees hurting. When they crack, every time I get out of chair, I go, that rocks.
I'm not going for that, right? And so like these companies with these unregulated treatments, and I put those in the hardest air quotes that I can get through the live stream, they prey on people who want to feel better, who want to get over these things, right? And that's, people want to be better, or people want to do better. And there's somebody out there willing to sell you snake oil.
Oh, they'll sell you anything.
All the time, right?
You hope it's just snake oil. Really? It's terrifying. You don't know. It's $30 compared to the like $1,000 you're paying at the pharmacy for the real stuff. Brother, what do you think that is? Brother.
Why do you think that is,
it's
brother? Salt. If you're lucky.
And maybe a drop of the active ingredient. But I mean, it's not regulated. It's not inspected. There's a level of scrutiny that comes with being FDA approved. And I mean, that also comes with inspections of your facility and like regular testing and like oversight. There's like oversight that comes with that. Which if it's approved for something, you're using it off label, you're still getting that safety. Like they don't put it in a different factory for you're not using it for that.
We got this off the back of Jimmy's truck. This is where these.
Yeah, I rolled it around in the dirt pit real good for you.
Off-label truck.
It's the off-label. Yeah, you're still getting the safety, but like, the compounded stuff that scares me. Yeah. Ooh.
Well, do we want to throw it back to the room?
Let's. I want to hear it. I want to hear your conceptions about weight loss and how, if your ideas about weight loss were challenged in this book, or if you felt like you were like, yes, this is, and especially like I found myself reflecting like as a woman, like a young woman who has been targeted like by so much of like the weight loss culture and like the weight loss messaging. Like there was some of this that was like, I was just like, I feel vindicated. Like, my set point's probably a little higher. I got broad shoulder. I'm built like a lineman. Like I'm probably not going to look like Kate Moss, and that's okay. So I want to hear from you guys. What concepts about weight loss were challenged in this book? Maybe how hard it is the psychological factors behind weight loss. I know that was new for me. I really hadn't thought about that, and how psychology and trauma can play into weight loss. So I want to hear about what you guys talked about in your Turn In Talks. Yeah, and go ahead and stand up and project like you're teaching at the front of the class. You don't have to stand up, but it'd be nice. Yeah. Ooh. Yeah. I love that. So overall, you felt like you agreed. Most of the points were good, but the point of shame doesn't work. Yeah, that's a great point. Yeah, talking about how shame in any form, culturally, societally, it doesn't work. Yeah, but it's so common, especially in American culture, right? Shame. You're shame for like being X number size or X number weight, or shame because you got a roll here, you got a this here. Well, that sticks out there. Girl, I got organs. What are you trying to shame me for organs? Like, and if you're a millennial or a Gen Zer, you know the hip dip conversation it's the way where your pelvis meets your femur. There's a dip anatomically. There is a dip, and there was this whole thing and trend on TikTok talking about the hip dips and how people were trying to, how do I fill these out? What exercise do I move my leg like this? Do I move it like this? And people were saying, no, that's your anatomy. That's where the leg bone's connected to your hip bone. Yeah, that's where it is. That's why you got a little divot. Nothing's wrong with you. You don't need to lose weight or gain weight. It's just how you're built. But that but the one Gen Zer probably listening to this, were there any other ideas about weight loss discussed in this book that maybe challenged, or were you reading this like, yeah, I've experienced these firsthand? Yeah. Yeah. Yeah, it's not just that you're eating too much. There's a reason behind it. Yeah, the psychology of it. Yeah, and the comfort. And he shares a few stories, not only about his own trauma, but the trauma of some others, who realized through their weight loss journeys and even through taking these medicines, yeah, that there were deeper reasons that they had the weight gain. And although a medicine like a GLP-1 agonist, like the semaglutide, you might lose the weight, but the underlying problem is still there. And even when you lose the weight, you almost have to, he talks about, you have to face that just head on. Now the weight is gone, and it's almost like if you're not ready for it, that could hit you pretty hard. And he, he talks about how there was what they called a safety signal put up in I think it was the EU initially, for increased risk of suicide for people taking these medications, because maybe in a clinical trial under the care of an investigator, so a clinician, they might not have seen this. Who knows? Some of these trials are a few weeks, a few months, they could be a few years. But I mean, these medicines have been around now for a while. People have been taking them for a while. And so now we're noticing that people, like they noticed that there was an increased risk of suicide. And that could play a part of it. I mean, who knows? And that's something that companies who make these drugs have been tasked with investigating. And it's something which is part of the benefit of having like a regulatory system and an approval system, because we have a way to report these side effects, and we have an oversight body, the FDA, the Food and Drug Administration, to say, hey, you guys make this drug. We're getting a lot of reports about this, and we think this is important, and we think you need to take a look at this, and you need to figure out what's going on. You need to do some extra studies, and that's really important. So regulation is good. Regulation's good, folks. I don't think I have another plug for that. But yeah, that's a really great point. The deeper reasoning behind that. I wonder, maybe this didn't challenge your ideas of weight loss, but did it make you think about the concept of the use of these drugs differently? And so, does anybody from their Turn and Talk groups have anything else they'd like to share about their misconceptions about weight loss? The set points, I think, were a great example, right? Maybe something that I don't think we really talk about when we talk about weight loss, that you have like a set point. I like how he talked about it like a temperature, like my body's a thermostat and I'm set to warm, cool. I don't know. Were there any other aspects of weight loss that you thought about differently, or maybe challenged your idea of weight loss? Yeah. Yeah. Share.
They were talking about how other health problems we have, specifically smoking,
Oh, smoking.
in the book.
He does.
How we were able to, as a society, reduce that based on its health without the kind of shaming that they go to
Yeah.
weight loss.
Yeah.
But we were able to make alcohol and talk about that.
Ooh. Yeah.
We don't accept what we're concerned about alcoholism, overuse of alcohol, without, I think, shaming people and proper health education. So, and he also talked about how other countries deal.
But with weight loss, it's not an education and it's not a compassion. It's a shame, and it's not working. And I love that you brought up his chapter about his trip to Japan and how he talks about how culturally how and I want to point out there was a lot of government intervention there, but at the same time there was a lot of government intervention with the smoking ads, right? And all of the labels that you have to put on the cigarette cartons and the dangers you have to have listed at the supermarket or the gas station, wherever you're buying your cigarettes. There's a lot of signage, there's a lot of warnings, and there's a lot of government action that was implemented to reduce the people smoking. Yeah. Yeah, we have a nicotine patch. That's true. Yeah. Yeah. Um, yeah. And yeah, that's a really good point. Um, I want to, yeah. So I want to get into the actual, so we talked about kind of weight loss, some of our misconceptions about it and the shame and kind of how weight loss is dealt with, right? Let's talk about these drugs, right? These drugs. It's a weed, it's a cocaine. It's a it's a weed, it's a cocaine, it's a GLP-1 agonist. um, I I don't know if there's any other drug that has come out and been approved in the last 10 years that would have gotten its own book like this, that would have been as popular as this, right? That any one of us would pick up and be like, oh yeah, I know about this. Raise your hand if you had heard about these drugs, these weight loss drugs, before reading this book. You had heard about them. You knew of them. Yeah, most of you. I think most people have seen an ad. You've gotten it on your Twitter, your TikTok, your Facebook, whatever. And if you didn't get it from a company that makes them, you got it from one of the compounding pharmacies, which is terrifying because you don't actually know what is in that. And I want to take this as a moment to say you have to be so careful with a compounding pharmacy. So when I say compounding pharmacies and a compounded semaglutide, that means that there's somebody who's taking the active ingredient and they're mixing it themselves, and then they sell it to you. What are they mixing it with? How are they mixing it? Yeah. The compounding. Let's go.
Sterile drugs.
Yes.
Companies spend hundreds of millions of dollars.
Yes.
They can properly build a sterile product.
Yes.
Compound facilities, if you look it up, the FDA website, there's numerous cases of contamination.
Yes.
Compounded drugs, GLP,
Oh no, not just the GLPs.
was actually a harmful contamination from HIV.
Yes.
So
Yes.
don't go
Yes. The compound. Yes. the companies making these drugs spend, there's such an investment to make sure that these facilities are clean. Yeah, highly sterile. And what's in there? It's on the box. It's on the label. You know what you're getting.
In the law, the FDA can only regulate if that drug is sold outside of the state. So you can have compounding
I see.
in Indiana.
So if the compounding facility is in the state, yes. And some states do. Yeah, some do. Yes. Oh, Michigan, I didn't know that. Yeah. So when we talk about, so you're getting the drug, you don't know how much of it you're getting, and you don't know if it's clean, and the risk for an infection or something from a compounded version of this drug being made and being sold and being used is high. And he really glosses over that, but it is actually a very real danger. But one of the things that we talked about in our turn and talk, we got onto the topic of safety of these drugs, and it's something that really, it seems like, spurred this entire book. He wanted to know what were the pros and cons of me taking this medication as somebody who has excess weight who wants to lose it. Is it safe? And that is a loaded question, right? Is it safe? Well, we test that in clinical trials. Before these drugs get to the approval process where they're being sold, via prescription, there are preclinical studies. So he talks about Cheesecake Park, which, by the way, just sounds like a cheesecake factory for mice, and I totally would sign up for Cheesecake Park. But in these like preclinical, we have preclinical tests where we test them in cells and we test them in animals, and we have phase 1 through 3. There's 4, but really 3 phases of clinical trials that these drugs go through. And at each point, they are assessed by the regulating agencies, which, again, I'm going to focus on the United States because I think that's where most of us live. Similar process in other countries, but we're focusing on the United States. The Food and Drug Administration, the FDA, is looking at the data at these different stages: phase 1 clinical trial, phase 2 clinical trial, phase 3 clinical trial, and they're looking at the data and they're saying what are they call them adverse events. It's the safety signals, right? It's when humans, not mice, when humans take this drug, what happens? What are they experiencing? He talks about gastrointestinal distress. He talks about, feeling nauseous or feeling, some people feel dizzy. Those are what we call adverse events. And those are things that we monitor. People putting on these trials monitor over the course of these trials. And that is all reported to the FDA, your regulatory body. So not only are they looking for, does this drug work and do what they want to say it does, but then is it safe? So, for example, when we talk about weight loss, excess weight and obesity, he very clearly talks about in the book, comes with an increased risk for a lot of awful diseases. We have heart disease, we have sleep apnea, we have, he talks about a bunch of them in the book. It comes with an increased risk for developing disease that can be deadly, and that's really scary, right? But obesity in itself is not as deadly as, say, cancer, right? It's not as immediately deadly, although he does talk about obesity increasing your risk for developing certain cancers, right? Or cancer broadly. So when we talk about, is this drug safe, part of what the regulatory agency, the FDA, is looking at is they're saying, okay, this drug treats obesity. This drug treats obesity, right? You are going to lose weight taking this drug. Are the risks, are the events that we saw in these trials, these very controlled, highly regulated trials, what we saw, what those patients were experiencing, those symptoms, we broadly refer to them as symptoms, side effects, it's probably how you've heard them called. Are these side effects of this drug, do they outweigh the benefit, right? Like if the drug's gonna kill you, it's not worth losing 5 pounds. Right? But for example, if you're looking at a drug to treat cancer, you might be willing to tolerate feeling sick, feeling tired, a little more because, well, the risk is not treating the cancer, right? So when we're talking about weight loss, it's something that is not, it's something that they have to consider in making their regulatory decisions. And it's something that they are looking at very, very closely. And so we were talking about like a drug getting approved, right? It's approved for people with type 2 diabetes, and approved for treating weight loss. That means that a regulatory agency, one, looked at the facilities. Those have been inspected. Those have been assessed for sterility. They're clean. The drug is safe. But the drug is, in that context, right, it's safe. But a drug is also safe in that it has been assessed by regulatory authorities. And what that means is a team of scientists and clinicians who are looking at this data gathered by these companies. So scientists and clinicians who are not a part of these companies, it is an independent board, and they're looking at this data and they're saying, okay, one, does it work? Two, does it do what they say it does? And three, is it safe? And so it doesn't necessarily mean there are no side effects, right? There are side effects with pretty much, I think, any medicine out on the market for anything you could imagine, right? There's going to likely be a side effect. But are you disclosing those side effects openly? Are you being upfront with those? Is another job of the regulatory agency, but also making sure that the patient taking that drug is aware of those side effects and is adequately educated about them. Again, part of the problem with like compounding and just getting them off an app online. You're not seeing a doctor. You're not talking about the risks. You're not like talking about the possible side effects. You don't actually know what the side effects are because you don't actually know what you're taking. So I think that the safety and the concept of like this drug being safe was really important part of this book, and something that I wanted to pose to you all as a turn and talk. What do you think of when somebody says, especially a pharmaceutical company, right, says a drug is safe or this is safe? What does that actually mean to you? And what do you think of when you think of something as being safe? And do you think that like when it applies to these drugs, do you think of safe? What is that? I feel like that's a loaded word, right? Like safe. So what do you think of a drug being when it's safe? What do you think a safe drug is? And so we'll come back in a few minutes and we'll talk about safety. Oh, no, don't unplug the things. Okay, we're plugged in.
Oh man, I just about kicked the power cord right out of the wall there.
Yeah.
Okay.
I want to harp on safety because
Okay.
I think this is so important for this class of drugs, and I think it's so important in the context of weight loss because it is a medicine.
Yeah.
Right. You're going to have side effects with whatever medicine you take. You have to be ready for that.
Yeah.
And I feel like what has happened with these medicines is we have people taking them off-label use.
Mm-hmm.
They're taking them for weight loss who maybe they're not categorized as obese.
Mm-hmm.
You know, they're taking them to lose that extra 15.
Yeah.
And then you have people saying, especially like younger people who are not obese, and they're going, I didn't know there were side effects.
Yeah.
I didn't know I was going to be nauseous. I didn't know that it was going to affect my ability to enjoy food. And it's like, well,
Yeah.
if you went through the proper channels, you probably would have known. And it's also really important. Also, it's not that this isn't safe. You shouldn't take this. These are assessed and rigorously tested in clinical trials. And, you know, they're assessed by regulatory bodies like the FDA and the EMA, you know.
Well, that makes me think about like other drugs that are, I think kind of what we're describing here is potentially like drugs that are being abused, because if you think about like if you don't actually need this drug, but you are, and I don't want to put any intention on it, but you found ways to get this drug prescribed to you, then when you may not actually need it, that's the second, I would say, kind of like check that we have in our medical industry, right? Is doctors are that line of defense to say like, look, from a medical side, these drugs are tested, they're used in these cases. That's what the FDA can do. They can make sure it's safe for its intended purpose. Yeah. But then a doctor has to be there to say, hey, you should not take this if you are already at your ideal weight or lower,
Yeah.
and you are trying to hit a weight that may not actually be healthy for you, right?
Yeah.
And I would assume we look at other drugs in these cases, but you look at the outbreak of the opioid crisis,
Oof.
right?
Yeah.
Like we look at the abuse of drugs like Adderall on college campuses, right? Like you're using it for a purpose that it wasn't intended to,
Mhm.
or you're completely overusing it
Yeah.
in a situation where you might not actually need it.
Yeah.
And that's causing effects that are bad, right? They can be
Yeah.
real bad in a lot
Yeah.
of cases,
Oh,
right?
yeah.
So
Especially if you opioid epidemic.
so like I kind of think of our
There's
system
layers to it.
as like, you've got to have, yes, an FDA regulated product, but then you have to have doctors prescribing it appropriately.
Yeah.
Or it doesn't matter how safe like the drug
Yeah.
is, right?
Yeah.
Because the drug's safe and tested for a certain situation, a certain
Yeah.
user, right?
Well, and that's a great point too, because when you're being supervised by a clinician and like a research, not a researcher, but like a clinician and a doctor, you're also getting, oh, well, you actually have a family history of, we talk about thyroid cancer.
Yeah.
If you have an increased risk of thyroid cancer
Probably
and,
shouldn't do
and it
this,
runs
man.
in your family, you probably shouldn't take this drug.
Yeah.
If I'm a 22-year-old college student looking to lose 20 pounds,
Mhm.
I'm not thinking about that.
Yeah.
And if I can get it, if I can go to CVS and give them $2,000 of my dad's money, because I'm a college student,
Hook me up.
hook me, and I can lose, 20, 30 pounds. Yeah.
That's
I'm
like
not
the
thinking
dream,
about
right?
that.
Just like, look, I just need this. Here's money. Make it happen.
Yeah.
Done.
And like the
Right.
concept of, I didn't know this was going to happen. I'm actually experiencing these things and it's not worth it for me.
Mhm.
And so ergo, the drug is not good. The drug is not safe. Well, that's not necessarily true.
Yeah.
And it just, I think that's a symptom almost of it being, it's not accessible because we have so many shortages. That's why we're having the problems with the compounded materials. But it being so ubiquitous.
Mhm.
And, if you follow certain celebrities, are they on Ozempic or are they not on Ozempic? Oprah lost all that weight. What was it? XYZ celebrity looks different. Is it Ozempic? And it's like, okay, well, like never before have we been inundated with so much about this.
Yeah.
And hearing so many experiences because so many people, the odds of you knowing somebody who are on this drug are high.
Yeah.
Or on this, I won't say this drug. It's a class of drugs.
Yeah.
Let's start there.
Yeah.
Ozempic, Wegovy, tirzepatide. They're all different. They're made by different companies. Same target, drug target, GLP-1.
Yeah.
It's a GLP-1 agonist. Like they're all the same thing, made by different companies. All independently assessed, all safe, according to the FDA.
Well, you touched on something there that popped something in my head. Like, we're also in a period where advertising isn't simply the drug company pays for an ad. It has to be very clearly regulated and monitored, and you have to have the certain fine print or whatever.
Yeah.
In a period where you can have influencers that are also pushing a product, right?
Yeah,
and
the
I'm not
influencers.
implying that pharma companies are paying influencers to push their
I
drugs,
don't know.
because I don't know.
I have no idea.
I'm just what I'm more driving at is like that double-edged sword, the very democratic nature of like kind of viral marketing that happens
Yeah.
versus the very like non-regulated and potentially dangerous side of very viral marketing, for example, off-label uses of drugs.
Yeah.
That seems dangerous, right?
Are they paying influencers? Probably not. Are influencers talking about it? For sure.
For sure.
Weight loss influencers, exercise influencers, health lifestyle, Goop. We've talked about. I don't know if I've ever talked about it here, like in this venue, but like Goop is a great example of just like and just supplements in general, even just like not rooted in anything
how you
of
can
this
just
world.
sell completely unregulated and dangerous things to people based off of the
Or
popularity
give them
of a
bad
celebrity.
advice.
Oh yeah.
I mean, years ago, I think this happened. I think this was years ago, unless my memory is terrible. The woman who was telling patients with cancer, just eat boiled cabbage. Nothing but boiled cabbage for weeks, and you will feel better. Your cancer will stop growing.
Yeah.
Nothing's stopping her from saying that.
Yeah.
Nothing. She can say whatever she wants.
Yeah.
But people are taking that advice
Mhm.
and hurting themselves.
Well, and the real problem with that is that like we have clear scientific evidence that will show that these things, and I'll pick on Goop because it's it's famous celebrities with a lot of money using their money to make more money by peddling things to people that
Yeah.
aren't helpful, and that it's really dangerous, and it's also really kind of I don't know which adjective I want to use, but it sucks for normal people who are really looking for something to help them. Those people are
Yes.
looking for something to help them. They need help. And
Yes.
instead of getting sound science, a regulated product that can actually help them, these people are peddling things
Yeah.
that they know
Yeah.
are not going to help these people.
Yeah.
But they sell that hope.
Yeah.
And that is dangerous, and they can hurt these people with that, which is
Yeah.
really makes you sigh a little bit.
Yeah.
Makes you
Well,
go, geez, guys.
Well,
Like-
and I'm so glad you bring up influencers, because when not me, but somebody peddles something that doesn't work or is actively harmful, there's no oversight. There's a comment section, but they can delete those comments and
Yeah.
they can ignore them, and they can keep making those videos. Oh my God,
Or you
Look
got
at my
dozens,
cucumber.
hundreds of Smurf accounts that go like, "Oh, this is so great."
this worked for me. I lost
Yeah.
10 pounds and my skin is
Yeah.
glowing. # whatever.
Yeah,
Yeah, well, and then that also, I think, goes into the benefit of a regulatory agency,
Yeah.
and the importance of that agency and that data,
Mhm.
and also, by the way, I mentioned last time, you can look up the label online. A lot of these clinical trials are published.
Yep.
And you can look at the data and it's called the safety table, your adverse event table, your side effect table. They don't call them side effects, so you might not think to look for them that way, but
Yeah.
they're your side effects. And
Yeah.
they detail, okay, here's what people experience, how frequently, the most frequent to the least frequent, that is available.
Mhm.
Not for Miss Cucumber Turmeric Ginger Cleanse.
Mhm.
There's no trial. If
Yeah.
you do have a side effect, it's probably gastrointestinal.
Yeah.
It is probably you in your bathroom experiencing it, and it's not going to get reported anywhere. And if you do seriously get harmed, people have experienced really severe side effects from these cleanses or detoxes or whatever.
Yeah.
You have no recourse.
Yeah.
At least here you have recourse.
Yeah, and one of the things that maybe just for the live stream, that we could preface this with is definitely not knocking holistic treatments that are
No.
hey, we need to take the full body in mind. A medicine might not always be the best way to approach it. It could be
100%.
exercise, it could be diet, it could
Yeah.
be these other holistic parts of treating your body. What we're kind of drilling down on here specifically are when folks selling supplements and products with a claim that it can act at the same level
Yeah.
or better than medical treatments. Those claims are backed by nothing other than the influence, the celebrity, the gravitas of the
Yeah.
person shilling it. And I use that term intentionally,
No.
as opposed to the claims of drugs tested under the FDA have thousands and thousands of data points in clinical trials and of history, and it's monitored, and complaints are actively monitored.
Yeah.
And those companies, their whole manufacturing process, their whole existence, their license to operate works on being able to prove that they're making the same thing the right way every time, right?
100%.
Unlike Jimmy with the truck of off-label stuff, right? That's just chucking Goop products out of the back, right? So that's
Goop freaks me out. Dude, Goop freaks me out. Yeah,
Yeah.
I don't know. It makes me think of how I do want to give credence to the holistic medicine and I'm not saying all holistic medicine is bad, and because I've been there. If you've ever had symptoms and especially women's symptoms tend to get dismissed more often than not.
Yeah.
You feel like you don't have any solution. Nobody's taking you seriously.
Yeah.
And all you have is that influencer saying, well, I healed my, cortisol levels by doing this, my PCOS, especially PCOS and endometriosis.
Yeah.
Yeah. Your doctor, is probably not going to take you seriously.
Yeah.
And they're not, what are you going to do? Okay,
Yeah.
I'll take some turmeric and
Mhm.
I don't know, cucumber, and we'll call it, I don't know. I'll try this diet. I'll try that. And because you aren't given any options. So there's absolutely a place for that. And you're right. It's when it's in lieu of a medicine, and especially in like a life-saving environment. And I think weight loss is where it's like a gray area, because some people don't see it as important or meaningful for even being a medicine. Why is there a medicine for that? Just get up, pull yourself up by your bootstraps and exercise. And it's like, well, it's not that easy.
Yeah. And it's, we had talked about in the previous Turn and Talk, the genetic, the epigenetic, the environmental, the hereditary factors that all play into obesity. And especially as you mentioned, PCOS and can you say the word for me? Because
endometriosis.
Thank you. I was going to butcher it like 3 times in a row. Like a lot of these have these roots in, the genetics and these things. That it's not just like, oh, I decided I was going to just lay on my couch and get PCOS today. Right?
I ordered it on Amazon. 2-day shipping. Like, it was great.
Yeah.
It was great.
It was great. Yeah. 10 out of 10 would not recommend. Yeah.
Yeah. Yeah. And I appreciate, though, that his concept of what it means for it to be safe changes throughout the book.
Yeah.
And it's, well, am I going to feel sick? What am I going to feel? And then it turns into, what are the long-term effects? And what does that mean? And have they looked at that? It's like, well, not for your cucumber, ginger, turmeric injection. They haven't.
Yeah. We haven't even touched on longitudinal studies and those.
Yeah.
You want to talk about a lot of work going in over a lot of time to prove that something has an efficacy and, won't impact you.
Yeah.
I guess that's the next page that we might turn to.
Yeah. Yeah. I think we'll turn to the longitudinal and how most people actually gain the weight back.
Yeah.
And that's the data. That's not.
Yeah. Sometimes when you tell your body with chemical signals, do this thing, when you remove those chemical signals, your body's like, oh, whew, glad I don't have to do that anymore.
Yeah. Well, and I explained it earlier. It's like caffeine.
Yeah.
Like, you drink the coffee, 1 cup. Well, now I don't feel the same effect. All right, 2 cups.
Yeah.
Okay, now you're up to 5 cups, and you're like, I'm too jittery. I got to come off it. And then you're like,
mainline in coffee when you wake up. Yeah.
Yeah, and your body's like, I have nothing. I am nothing. I am sleep.
Do you want to toss it
Let's
back?
go.
Okay.
Let's go.
Let's go.
Yeah. I just think safety, I don't know. I think the concept of safety with any medicine is really important, and anything you're putting into your body. And, I thought about this question because I was interested in how the author looked at safety through a different lens as he went through. And initially it was, well, is it safe enough for me to take it? And then is it safe enough for me to take it? And then like psychologically, am I going to be the same? And then it was, well, what about the long-term effects? And, we can get into some of the longitudinal studies and what it means to not only be on this medicine for a long, safety in when you're taking it, but safety long-term. What are the long-term side effects? That's a question that you want to ask yourself of any medicine you're taking. What is the long-term effects even after I'm off of this medicine? That all is like safe and safety. And when you're putting something in your body, you want it to be safe. And so I want to ask, what is safety? What is safe? What does it mean for this drug to be safe? What are you thinking of when it's safe? I think of baseball. I go, safe. That's why I keep doing the hand signs. I'm like, it's safe. And that is exactly what the FDA does. They go like this. They go, you're safe. Not really, but that'd be great. I don't know if they're taking suggestions, but totally pitching that. Yeah. 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 Yeah, defining safe and safe. That's a great point. Is it safe for the person who has obesity and is experiencing comorbidities or other diseases as a result of that excess weight versus, somebody who just wants to drop 10 pounds for their friend's wedding so they can look good on Facebook? Yeah. And it's not just, is it safe? Is it safe for? Is it safe for me? Is it safe for you? Is it safe for this person? And who answers that question? I talked a lot about the regulatory agencies because the compounding, I'm telling you, it really freaks me out. And I'm very thankful for our FDA in that sense. But it's also, is it safe for, like when deciding, is it safe for a doctor? A doctor will help make that decision for you and work with you. And that's why the clinical trials, they're always working, in a clinical trial setting, you're working with a doctor. And hopefully if you're getting prescribed this medicine, that means you're working with a doctor who is helping make that decision because they also are looking at the data, and not only the data, your medical condition and your medical status. That's a great point. Yeah, safe for. Is it safe for us, you, them? Safe for. That's a really important question. And it's not one size fits all. Pun not intended, actually, for that. One size fits all. What else do we think about with safety? We talked about like supplements and like if you've ever seen, we talked about Goop. We talked about Goop. If you're familiar with, who's that, Gwyneth Paltrow? Peddling like supplements and detoxes and think nobody's looking at that. Nobody tests that. Is it safe? But both are saying you'll lose weight. One is a tea that came from someone's backyard maybe. And one is a medicine. And it's not to say that the holistic medicine doesn't have its use or purpose, but is it safe? Is it safer? Safe? There's even a comparison maybe you need to make. Is it safer than my current weight? The side effects of taking this drug or what might happen. And you don't know. That's the scary part. You might not know until you take it. And so is it safer than what you're actively experiencing? And I think that's something that, you have to work with a medical professional. Got to work with your doctor. They talk in the book, for example, about how there's a higher incidence of thyroid cancers, and that if you have a history of thyroid cancer in your family, you should be very cautious if you're considering these drugs. If I am a 20-something-year-old college student trying to take this to lose 15 pounds for a wedding to look good or for a sorority event or something, I might not even realize that thyroid cancer runs in my family. Surely wouldn't ask a doctor, and mention that. But that's really important for determining if it's safe for me. And I don't know, as I read through this book, I kept coming back to, as we went through these stories of these patients, the patients that he was interviewing, taking this medication, I just kept thinking about how he always centered his conversation and centered it about like, what, not only is this the right decision, but making sure that like it's the right decision because in the context of my medical history and the drug and everything, it's safe. And that it's just such a loaded word to be safe. And it's not to say it doesn't come with risks. Because certainly the ginkgo supplement being sold by that pretty girl on Instagram certainly is not getting the same amount of attention, right? And again, not to say that holistic medicine doesn't have a purpose, but you have to really think critically about that weight of safety, safer than, and not even to dismiss those who cannot get medical help. They can't get a medication. We talked about endometriosis and PCOS. And he actually talks about this in the book. Women's medical history and women's medical experience are so often dismissed, and your symptoms so often dismissed. You're not given a medication, and you're not even given the option to explore a medication by your doctor. And so many women and women in minority groups feel so betrayed by the medical system and by their doctors that they feel like they have to go to that influencer. They have to go somewhere else, and safety is no longer a concern. And it's about, I just got to try something because I am not getting anywhere, and I'm experiencing these symptoms, and I'm experiencing this, and I'm not getting any help. And that's really scary. And I've been there. I told you at the beginning of this, I have a PhD in cell biology. I have been on that side of the internet where I'm going, what supplement can I order? Because I am experiencing this symptom and my doctor's not taking me seriously, and I need something, right? And weight loss and obesity and excess weight gain is something that is so ubiquitous and just so commonly experienced. I think this is the first time where we're not only having to turn to those forums and we're not only having to turn to like those supplements, we actually have a medication. And that's really exciting, I think, for a lot of people, especially those who are able to benefit from it. Like, that's really awesome. Is there anything else that anyone wanted to talk about, like safety and like thinking about a side effects of a drug? I don't know, are there side effects to turmeric and ginger? I keep going back to turmeric and ginger. I actually really like turmeric ginger shots, but I'm trying to think if they have like side effects. Sometimes I get a headache, I guess. Yeah.
I think the bottom line is the consumer has to be aware.
Awareness. Yes.
You covered quite a bit. You're talking about
Yeah.
drugs that are regulated, heavily regulated through the agency and it's gone through a variety of things. First of all, one thing I want to comment on safety,
Hmm.
and we were talking about thyroid cancer.
Yeah.
The safety of a drug is not just dependent upon what is seen in human clinical trials.
No.
First phases are done in animals.
Yes.
So
Preclinical.
something is seen in an animal, either a mouse or a rat or dog or whatever.
Yeah.
That might be included in the warning.
Yes.
That eventually is included, even though
Yeah.
it's not been seen in humans.
Yeah.
So that's number one.
Yeah.
I think the main thing you try to talk about is risk versus the safety of the drug. You have a good point there. The author brought this up at the end about who should take these drugs. And if somebody's just taking them just to look better,
Yeah.
maybe that should be somebody who should take them. Maybe
Yeah.
if you're somebody who is at risk of obese-related morbidities,
Hmm.
then maybe that risk is worthwhile.
Yeah.
Third, a lot of the things that we're talking about, too, are not regulated at all.
No.
Dietary supplements, which is a huge group, are not regulated.
It's massive.
It's massive. But if they're not safe, okay, they can stop, but they don't have to show evidence. So
Well, no.
when I go to the GNC and I can buy an ampule or a vial, I mean, Pathfinder's DNA that's
Yeah.
I don't think that's efficacious, but it's probably safe. So, I mean,
Well,
this is like what Culco's thing and all these other things.
well, that's,
I mean, they're safe, but do they really work? That's up to the consumer, unfortunately.
Yeah.
I don't know.
well,
So
yeah.
you just have to be knowledgeable, aware, think through it, read about stuff, think about it,
Taking a balanced approach to everything from and it's everything from supplements to medicines, and you just have to be really cautious. I think about all of it, and especially weight loss medications. And I think I pointed this out at the beginning, but these medications initially were developed because of their effect on insulin production, right? And insulin production, by producing insulin that triggers your body, like for example, your skeletal muscle, which is a huge glucose sink in your body, to suck up that, I just think of them like little mouths on your muscle, sucking up that glucose out of your blood. And that is part of what GLP-1 does. And that is why initially this was tested and discovered and approved initially for patients with type 2 diabetes, because it helps regulate blood sugar. The weight loss actually was a side effect. And a good side effect, right? Removing excess weight and removing some of those obesity-related complications that can affect patients with type 2 diabetes. But by looking at it as a drug for weight loss, it's the same mechanism. And what is this drug doing? It is not causing the weight to just disappear into thin air. It is changing your metabolism. It is changing the way that your body responds to food, both cellularly when we talk and biochemically when we talk about insulin and glucose, right? But it's also changing By changing, especially insulin and even GLP-1, we learn about it changes your brain and the way your brain is responding to food, and it changes the psychology around how you interact with meals and food, and how that plays a role in your life. So these medicines are not, we call them weight loss drugs, but they're not really weight loss drugs, right? I mean, they are a drug like any other, targeting a biological system that already exists in your body and is tweaking it in a way that produces an effect that we want. And so, when we talk about the safety, we want to talk about the long-term safety of these. And the reality is the data shows that like a majority of people after they come off of these drugs in the long term will gain the weight back because you're no longer altering that biological process, right? But if accommodated with lifestyle changes like a healthier diet, a more well-rounded diet, or exercise especially, by building up that lean mass, we're building up the amount of muscle that's sucking up that glucose, right? We're helping to like build a better baseline, and maybe you won't gain all of that weight back, or you might not gain any of the weight back at all. Some patients don't. They come off the medicine and they just live life and nothing happens, and that's great. But long-term safety, and they even talk about women who are looking to get pregnant or are pregnant should really reconsider or talk to their doctor about being on these medications, because we don't know developmentally what that could do. And even they're talking about giving this to teenagers or children who are obese, pediatric. You're still developing. We don't know what that might be doing to their pancreas and to their islet cells, which are the cells in your pancreas that make insulin, or even their brain. We don't know if that's going to change the way that your brain responds to food and meals. And that's really dangerous. And so maybe a drug is safe for an adult, but it might not be safe for a kid or for other groups. And that's just something that is going to have to come out with further testing. But it's all about what these really coming down to the science of what these drugs do and don't do. And we call them weight loss drug. It's a weight loss drug. It's a miracle drug. No, we're just altering the biology the same way we do with every other medication. We're altering the biology that's already there in a way that produces a favorable outcome. And so I think at the end of the book, kind of coming to the conclusion that like it was safe for him, and he felt like it was the right choice for him to make, but coming out of really, really balanced view of there were a lot of considerations, both socially, mentally, and physically that he had to consider, and that, just because you are obese or have excess weight and you want to take these medicines doesn't mean maybe necessarily you should, because we don't know long term if you have a consideration for your biology that maybe needs to be taken into account, and we just haven't studied it yet. And that's, for a scientist, that's fun because that means there's so many different possibilities and things we can learn about it, but it also means we don't know. And there's a lot we don't know about these drugs. And if that makes it not safe, well, we don't know. So there's a lot, I think, still to be uncovered. So I think there's going to need to be a follow-up to this book in like 5-10 years when we explore some of these deeper, longer questions. I think we're pretty much at time. So if any of you want to come up, we can chat afterwards. If you're on our live stream, you can leave a comment, and I'm on Facebook. So I will definitely get in there in the comments on this video. Otherwise, I do want to announce, I will go ahead and wrap it up. There's so much to talk about with these drugs. And I think what's important to leave with is that they're still under development. There's so much we don't know about them. And I think you're just if you're interested in these drugs, you just need to keep following. Follow the science, follow the research. These clinical trials are published and they're public. So if you are interested, you can actually and not just in these drugs, any drugs. Most of them are published. Actually, if you go to ct.gov for specific clinical trials, those data have to be published legally. That's part of the transparency that comes with a regulatory agency, which is why they're so nice to have. If you want to see actually see the data and look at it for yourself, you can, and you should follow if you're interested in these, because it'll evolve as the years go, and we'll see if it turns out like the horror stories that we learned about from some of the weight loss drugs of the past, or we'll see if new and hopefully less exciting and more mundane observations come out. So I will use that to wrap up our discussion. Please join us in October. We are actually changing our book because for the month of October. So we initially were going to read Artemis because of the Artemis launch. Now the Artemis launch for my space gurus out there has been rescheduled. So we have decided to pivot, and instead we will be reading, I think it's called To Engineer is Human. Yes, To Engineer is Human will be our book for October. I don't know if engineering is scary. Is that a Halloween theme book? Is that a Halloween theme book? I think engineering is a little scary. That's true, when bridges are designed wrong, that's scary. Ergo, engineering is scary. And there's a lot of math, which I know we read Mathematics for Human Flourishing, which made math not scary, but it still is a little scary for me. So sorry to that author. So join us in October where we read about the horrors of engineering. And we will be back here at Ash and Elm, so come join us. Otherwise, thank you so much and enjoy your fall. Thanks. Bye, live stream. Illy.